Okay, I can't be the only one who thinks this. So if you think that getting bariatric surgery is the easy way out, I'm sorry, but you're dead wrong. I'm Tiffany, I'm a physician assistant, but I'm also a GLP-1 advocate. So I spend a lot of time helping people get access to weight loss medicine that don't have access. But I also have lots of people in my clinic that have had a previous history of bariatric surgery. And let me just tell you, if you don't know what all people go through who have had bariatric surgery, you're in for a treat. So first of all, before you can even qualify for bariatric surgery, most people have to go through at least 6 months of a medical and nutritional counseling. So it's not like you just go in and say, hey, please give me a gastric bypass, and they do it. Secondly, it's a huge procedure. And then you basically have to eat ground up liquid diet for up to 6 months after your procedure. Now, everybody's different and a lot of people can progress their diet a little bit quicker than that, but I've got people who literally are 6 months out and are still not able to eat solid food. Honestly, I have people who are years out from bariatric surgery and are really not able to eat a full meal. Like they can sit down with their families and they really can't eat what their families eat. I'm going to make the very bold statement that people that have bariatric surgery have to change their eating forever. Now, unfortunately, I don't have hard statistics for you, but I will say in my own clinical practice, there are a great deal of patients that have had bariatric surgery that unfortunately go on to gain weight back. Maybe not back all the way to their original weight, but we do see a lot of weight gain post-op. The reason is because when you have bariatric surgery, you really don't address anything at the metabolic level. We haven't changed any of those hormone imbalances that led to the obesity in the first place. Which is why GLP-1s have absolutely changed the horizon for bariatric surgery from here on out. I'm going to make another bold statement, and you can save this video and come back to it later and tell me whether I'm right or wrong, but I think GLP-1s are going to greatly reduce and maybe even completely eliminate the need for bariatric surgery within the next 10 years. Oftentimes, a lot of my bariatric patients, when they get through the post-op period and are back to eating regular food again, actually need to be put on a GLP-1 just to get the metabolic dysfunction in their bodies addressed, which theoretically should have been addressed prior to. But a lot of my patients actually had bariatric surgery long ago when GLP-1s were not even really in existence and certainly not being used for weight loss alone. So people with a history of bariatric surgery definitely don't have it easy. They suffer lifelong nutritional deficiencies. They have to completely change their eating forever. And certainly we have not really fixed their issues. So I'm going to go on to say that I really think if you're considering bariatric surgery, that you should really strongly consider trying a GLP-1 first if you have not already. And I think any doctor that you're going to or provider should really point you towards that first as an option to see if that will help address the metabolic dysfunction within the body prior to thinking about undergoing a big surgery. If your insurance does not cover GLP-1s for weight loss alone, there's a link in my bio. You can grab that link and then get started on compounded GLP-1s, and hopefully that'll help some of you that don't have insurance access. Drop some comments for me and tell me what you think about bypass, gastric, lap band, all the things, and let me know if you've had it in the past.